Hello, everyone. Thank you for being here. My name is Alqasim Elnaggar, and I'm honored to present our project titled Enhancing Health Leader Experiences in Sideline Sports Medicine: Insights from a Postseason Survey, conducted through the Detroit Public School Health Corps, otherwise known as DPSHC. So first, we're going to discuss the project aims and the importance of our project. What is DPSHC? The DPSHC is a student-led initiative that trains medical students to provide sideline coverage at high school sports events. Our rules include first aid care, concussion assessments, hydration support, and escalating to on-call physicians when needed. Currently, we cover 6 sports: football, basketball, track and field, baseball, softball, and soccer at the Detroit Public School high schools. So the importance of our organization. This initiative does 3 key things. First, it offers real-world clinical experiences to students early in their training. Second, it addresses healthcare disparities in Detroit's underserved schools. And third, it improves athlete safety and outcomes during sports events. The aims of our study. We wanted to assess and improve the experience of our health leaders on the field. To do this, we identified pain points like supply shortages, communication gaps, and safety concerns, and we saw opportunities for growth through a structured quality improvement process. So our quality improvement methods. We created a postseason survey using Google Forms, which was sent to all 13 health leaders involved in the 2023-2024 academic year. The survey included both quantitative and qualitative questions designed to identify actionable feedback. So the survey topics included were coach communication, schedule reliability, equipment access, safety, and opportunities for professional development. We analyzed this data to find common trends and guide our next steps. Here were our findings. So our key findings: 100% of our health leaders reported growth as medical students. 92% of them said that coaches were responsive and their game schedules were accurate. However, 38% of our health leaders cited a lack of supplies and inadequate training that needed improvement. Finally, 8% expressed concerns regarding personal safety. The most consistent theme in the qualitative responses was the need for more robust training and better access to medical supplies, especially during high-intensity sports such as football and basketball. Impact and next steps. We responded in 3 major ways. We redesigned our training, which was previously a 1 hour lecture with 20 minutes of splinting practice and is now a simulation-based workshop with live actors and real scenarios. We also raised over $5,000 through alumni funding and a Patagonia fundraiser sale. We used $2,500 of that to purchase essential supplies such as tape, pre-wrap, heat packs, and 5-gallon hydration jugs for each school, which we are in the process of procuring. Furthermore, we have started a hydration and health education initiative for our students that we plan to administer in the fall. In conclusion, we conducted a survey on our 13 health leaders. Our biggest needs for improvement were access to supplies and quality of training. We raised funds for more supplies, and we're currently in the process of procuring hydration equipment such as 5-gallon jugs and squeeze bottles. We also changed our training format to have a more interactive form, allowing more engagement from our students and better outcomes. Early feedback from our basketball season also suggested that these changes are working well, and we plan to reassess with another survey at the end of the spring sports. I'd like to thank all the volunteers, on-call physicians, DPS leadership, and especially the student athletes who trusted us on the sidelines and made all this work possible. Thank you. So to close off, I have a few anticipated judge questions, and I'll begin and give my answers. So firstly, how did we ensure the reliability and validity of our survey responses? We ensured reliability by having consistent distribution and clear structured questions across the respondents. We also made sure our survey content aligned with real-world challenges that we noticed and were voiced in prior debriefs and meetings. We also included both quantitative skills and open-ended questions to narrow down those themes. What metrics will we use to evaluate the success of our changes during the next sports season? We plan to re-administer the survey after the spring season with identical questions to enable direct comparisons and ensure that our pain points were addressed. We'll track improvements in reporting training satisfaction, supply adequacy, and safety. We also plan to collect sideline incident logs to objectively assess the preparedness of our health leaders. Third, how scalable is our initiative beyond Detroit, and what challenges would I anticipate? The model is scalable with proper collaboration between schools, medical students, and on-call physicians. Challenges would include funding, liability management, and adapting training to different sports environments. The framework, however, if followed, is very possible to be applied to any underserved district. Thank you for listening to my presentation.